I'm Haley Harman, and I'm going to be performing my health assessment. This is the halfway point. So I would first walk into the room, perform hand hygiene, introduce myself to the patient, ask for name and date of birth. I would see that I have adequate equipment, have lighting, and I would visualize the patient's general appearance. The patient looks like a healthy individual. There are no deformities that are obvious. As I walk in the room, I would also provide privacy, and I would visualize the patient's mobility, ask her to get up and walk, or visualize as she's walking into the room. See that she has a steady gait, full range of motion. I'd ask her to lift her arms up with your arms beside your ears. So lift all the way up as high as you can go. So she has full range of motion. Maybe move them in a circle. She has full range of motion. She doesn't have any involuntary movements. I would look at the patient's personal hygiene as I'm doing my assessment, and note if there are any areas that have any significant odor or anything like that. I would look at her skin color to see if she has any cyanosis. Be checking to see if she's well groomed throughout my assessment, and she does look to be well groomed. I'll look at her hands. I'll look at her nails to see if she has any problems with her nail beds. Her nails are smooth, they're painted, so it's hard to see the color, but check her capillary refill, check for peripheral pulses. Then I'll move on to the lower extremities, doing the same, checking the nails, looking at nail beds, and checking peripheral pulses to see if patient has any kind of venous insufficiency, and she looks to have good skin color throughout her body. As I'm going through, I'm talking to the patient, assessing her mood, her affect. She doesn't appear to have any mood disorders. Her speech is clear. I would listen to see if there are any problems. At the same time, I would be assessing her hearing, if she has any problems hearing me talking in a normal voice, and so far she doesn't. As I'm going through, I'm looking to see if she looks malnourished or possibly obese, and she's neither. She is making eye contact with me, and she has appropriate orientation. I would ask name and date of birth, where are you today, and do you know why you're here, do you know the date. As I'm going through, I'm going to start at the head. I'm going to palpate her scalp, and at the same time I'm inspecting it to see if there are any deformities, and there is not. So from there, I'm going to be looking at her hair. There seems to be no problems with the hair. The cranium, her face is symmetrical. So I would get in front of her face, see if there are anything that is not symmetrical. As I'm assessing her face, I'm going to be feeling her temporal artery, and then her temporomandibular joint. Can you open your mouth and close it? And there doesn't seem to be any problems there with popping or any tenderness. At the same time, I'm going to be assessing her sinuses and to see if there is any tenderness, and there is not. I'm going to be checking her, can you take off your glasses? Checking her corneal reflex, and by doing that, no, not corneal reflex, testing her corneas to their reaction to light. So I'm going to have you look straight at me. And then I'm going to shine in the other eye. And then same with the other side. Shine it and looking for if they are perla, pupils equal round, reactive to light. And then I'm also going to test accommodation. I'm going to have you look at my finger here, find a spot on the wall behind me, and then look back at my finger. And they do accommodate. While I was assessing her eyes, I was also looking at her sclera and her conjunctiva. Her conjunctiva is pink, her sclera is clear. Another thing we could possibly do here is a Snellen test. I would have the patient stand a distance away and cover one eye and read the line that she can read. Same with the other eye, and then with both eyes. Now I'm going to be moving on to ears. Now you can put your glasses back on. I'm going to be looking in the ear with an otoscope. I'm checking the canal and the eardrum. The canal, there seems to be no problems there. The eardrum is a grayish pearl. Same in the left. I'm going to be looking in the mouth. So I'm just going to have her open her mouth. I'm going to look at her tonsils and grade them. Check her uvula and say ah. Ah. So that is also checking the gag reflex, looking at her teeth, seeing the color of the mouth as well, and hers is pink and it is moist. So I'm going to be checking her neck. I'm going to palpate a carotid pulse. And then I'm going to check for any masses or tenderness or any swollen lymph nodes, anything like that. And there doesn't seem to be any. As I'm doing that, I could also be assessing the symmetry of her shoulders, and watching her chest rise to make sure that it is symmetrical, and it is. Now I'm going to percuss. On the front, I'm going to percuss in areas 1 through 5, checking for any dullness. There's not. And I'm going to be doing the same with areas 1 through 9 on the back. All the way down. Can I have you scoot up from the... There doesn't seem to be any dullness that I noted. Now I'm going to be auscultating her breath sounds, using both the bell and the diaphragm of my stethoscope. So just breathe normal. Okay, and with the back. Her breath sounds are clear. There are no wheezes or crackles. Best practice would be to listen stethoscope to skin, but for the purpose of this video, I listen through the clothing. I'm now going to be listening to the heart sounds as well, listening to all 4 valves. And I'm also going to be listening and counting her apical pulse for a minute. Okay, I got a heartbeat of 60, and that would be perfectly normal for an athlete. As I was counting, I was also visualizing the chest to see if she was barrel chested or anything like that, and she was not. Thank you for watching this video.